East Riding Leisure is an award-winning leisure service known for its industry health programs and use of cutting-edge technology. The service has 10 major leisure facilities, which attract over 6 million users a year and offers over 500 health and fitness classes a week. We have our very own online booking process, which helps ease customers into the leisure centre and avoids queues at the reception desk. That means our reception teams can focus on the customers that need assistance, making their experience as personal and individual as possible.
We have 3 schemes at East Riding Leisure: our exercise referral scheme, our Live Well scheme and our Health Plus scheme. The health agenda is designed to encourage people who may not use the gym or a leisure centre but actually can get some real health benefits from using the centre in all of its aspects.
Public Health's been involved for many years with encouraging physical activity and encouraging general health. Really what we do, both when we were part of the NHS and even more so now we're part of the council, we are here, or one of the reasons we're here is to encourage people to be more active and live a healthier lifestyle.
So we work with a lot of other companies, such as Bodytrax, who are great partners of ours. We are able to work with them to develop the machine to what we want to make sure our clients get the best knowledge and the most up-to-date technology and advice that we can give them. We also work greatly with Hull University, and they are brilliant, and they analyse our data, they give us the top research that's out there on how we can improve our schemes and keep developing with the times. We ensure we give the best customer service from what they tell us.
Our objective at the University of Hull is to streamline the East Riding delivery infrastructure so all approaches and measures are academically robust. That means they can stand up in comparison against any other scheme, nationally or internationally. The benefit of the East Riding approach is it doesn't scare clients. We're not like telling them to lose weight or anything like that. Rather, it's functionally significant. Trainers are actually working to help the clients experience short-term wins. That is, being able to walk up a flight of stairs, being able to get out of a chair unaided. These are huge, dramatic things for some of these people that actually inspire them to think that the lifestyle choices in terms of exercise or diet are actually choices that are worth making. The next step is actually to disseminate the findings of the success of the East Riding programme so we can actually show them in peer-reviewed journals and actually present at scientific conferences both nationally and internationally. We are placed to position East Riding Leisure at the forefront of the management of community overweight and obesity programmes.
Well, our working with leisure services really involves several schemes whereby we help people who've got particular need and barriers to accessing physical activity and advice on healthy living. And what we do is we have worked for many years with leisure services to get a system whereby people are helped individually and personally and guided in order to have a programme which helps them and have a lifelong change, so that they change the way that they live and the way that they behave to take on a programme of lifestyle change and just general better living. And it's worked fantastically. It's been game changing in the local system and is nationally award winning, and we think it's a really fantastic partnership.
So exercise referral is a 10-week programme for anybody who has a medical condition that may want to get a little bit more active to improve that medical condition. So it may be something like you've had a stroke and you want to get more active to help with any after effects of that stroke, or maybe you have a mental health condition and you want to alleviate some of that stress and anxiety. Our instructors are here for 10 weeks to help you improve that medical condition.
Working with our partners in public health and the local clinical commissioning group, East Riding Leisure operates a very successful GP exercise on prescription scheme, where 1,600 patients a year are directed to us via GP surgeries in the East Riding. Some surgeries use the East Riding Leisure software, where patients are referred and booked in directly at the surgery. Our health and well-being staff are trained in motivational change techniques, and East Riding Council continues to invest substantially in staff's ongoing education.
Yeah, the exercise on referral, it's a good thing because it's helping me lose weight, it's helping me hopefully bring my blood pressure down. The gym instructor, Paul, he's great. Everything that he does, it's tailored to me. He knows my underlying problems, and I'm feeling a bit better in myself. You know, I'm feeling a little bit more confident, and I'm just glad that I'm losing weight.
Russell's in a wheelchair. The thing about it is that you can exercise whether you're like less able bodies. So we can find a number of exercises for Russell to do. He's doing really, really well. He initially had a lot of shoulder problems and they're getting easier through the exercises. He said today, for example, he's able to get around a lot easier in his wheelchair because of the exercises.
Initially, I'd been medically retired off from work and due to 2 hip replacements. And the issue for me was after those hip replacements, I had very bad mobility. So subsequently I went to my GP because I'd heard about the exercise referral. I improved massively. I was able to just recently travel to Rome where I knew that it was going to be a walking holiday. And although I was only able to walk maybe a quarter of a mile, when I got to Rome I was walking 6 and 7 miles a day.
So Live Well is a 12-month scheme for patients with BMI of 45. We support and encourage our clients to lose the weight with nutritional advice, exercise advice. And it doesn't necessarily need to be exercise in the gym. We look at using all of our facilities, including the sports hall, the exercise studios, the swimming pool, home exercise. And we just encourage people to get out, get fitter, get healthier, and we see some great results with weight loss.
Anybody can benefit from just joining a gym or the exercise referral scheme and Live Well scheme. They ensure they get that one-to-one support along the way, with it 10 weeks or a year. They've got an instructor they can go to they feel comfortable with if they have any problems or queries along the way with anything, and we can help them out, give them a bit of advice.
Health Plus is for everybody. Anyone who wants to come in and get a little bit more active and join on one of our memberships, they get offered a 3-appointment scheme in their first 4 weeks of their membership. The first appointment is an introduction to the centre. You'll get shown around, we'll get you set up, and then write a programme that's specific for you. The second appointment is more nutrition based. We give you advice on nutrition and look at a food diary, and then we offer a body track scan. So the third appointment is a review of your programme, ask any questions that you might have within your first 4 weeks of your membership, and encouragement to use other facilities, the swimming pool or the classes.
The partnership that we're working at does many things. If people are fitter and carrying a bit less weight, then the outcomes for surgery are likely to be much better. People will recover quicker and have fewer complications. And also sometimes surgery isn't needed, particularly say with bariatric surgery. People may well be able to lose the weight and then neither need the surgery nor want the surgery, and be able to live a healthier, happier life without all the risks that surgery entails.
So people that come onto our health agenda schemes have had some massive results. People that are on Live Well are losing 8, 9, 10 stone and completely changing their life, their confidence. People on the exercise referral scheme, we had one gentleman who's had a stroke and his goal was to walk his daughter down the aisle, and we worked with him and he did amazing, and he managed to walk his daughter down the aisle with a stick, and he was so happy.
Majority of the clients we have never exercised, never used the gym before, so it does kind of take a bit of building a relationship with them to trust us to get them in the gym, get them exercising. and make them realise it will actually be a benefit to them, and it will actually improve their health and their lifestyle.
The East Riding Leisure approach to behaviour and healthy lifestyles is actually game-changing. Through a network of GP practices and leisure centres, they're actually delivering something which is rarely seen, and that's interventions with population impact.